Hello and welcome to the Freedom from Diabetes channel, where we are bringing you valuable information related to your health. I am Dr. Mayurika Das Biswas, and today we have an expert who is a legend in her field. She has dedicated decades of work to the field of physiotherapy and rehabilitation. She is a Ph.D. guide. She is an enthusiast in women's health, an expert in yoga, in electrotherapy. She has many certifications in yoga. She has done her Sangeet Visharad also. She has over 30 publications in national and international journals. She has received a Lifetime Achievement Award. I am so delighted to invite Dr. Nilima Bedekar on our show. Nilima ji, thank you so much for your valuable time.
Thank you, Dr. Mayurika, to have such a big introduction. But I feel it is good to talk about something to people where we need to do pranayam in and out every day. So I feel something everyone should get from this talk and should be benefited, should be able to practice a bit. So what the topic for today is pranayam, is it?
Yes, ma'am. So what I understand is that a lot of people make a lot of mistakes in practicing pranayam, and there must be a lot of common mistakes that people make that they don't even know about, because a lot of them have learned it from some video, from some YouTube video or somewhere else, and then they have been practicing. They've not directly learned from a teacher. So there is a difference when you directly learn from a teacher will correct and tell you, okay, there you are going wrong. So I want to know from you, what are the common mistakes in pranayam that people make?
Sure, great. I would say what pranayam means is, to get the energy and to spread that energy within the body. So that's pranayam. Normally when we do breathing, that is taking the breath in and breathe out. Now when we say this, actually there is much more deeper respiration inside the lungs happening. That air, the oxygen and carbon dioxide is shared when this happens inside. When we breathe, it is very natural. We don't even think that we are breathing. Now, if we are doing pranayam, then we are actually changing something in our body and we are voluntarily making that change. So we have to be very cautious when we do pranayam practice. It is really good for health, but we should be aware that too much is also not good, because this is voluntarily changing something in the breathing pattern. Eventually, when we practice pranayam for many days, it will happen naturally. Like if some people have hyperventilation, that normal respiratory rate can be between 12 to 16, but some have more. So if that also should get, normalized. If there are certain lung conditions, that respiratory rate needs to be normalized and respiration needs to be breather deeper. Normally, when people do a lot of exercises, their lung capacity is good and everything. But with aging, or if we are not doing too much physical work, then the lung capacity also gets reduced. So pranayam has many benefits. We will just check 3 or 4 techniques, which I feel will be very good. But we should know that simple Dirgha Shvasan is the first thing what we need to do, and that can be done by anyone. So even a person who is in bed, is been advised bed rest, there's no problem in doing Dirgha Shvasan and Anulom Vilom Pranayam. So what happens when we do this? We are actually allowing the oxygenation to reach the tissues. If you are very stressed, our breathing becomes very shallow. It doesn't reach deeper. So the oxygenation to the tissues doesn't happen like a normal. So even patients who are in bed and bed rest should be doing some form of a pranayam. I would advise not to do this in completely lying down. You should be slightly up. So if you are giving, it should be tilted. If the person cannot be even supported, we can support it and get it upright. so that the diaphragm is not pressurized, and all breathing techniques ideally should be done in reclined or sitting. So that is the first thing which we require. Of course, if the person is not allowed to sit, then we will say still do in a lying down, in a sideline, both the sideline, or just get the head slightly up. So anyone can do pranayam, which will be the Dirghashvasa and Anulom Vilom. It doesn't have any side effects, any problem. So that has to be very clear. But as I said, when we do this, start with doing 5 cycles. Because when we are doing this voluntarily, that's going to change. So we need to take care when we start definitely something new. If already doing, then that might be okay, because blood pressure and the pulse rate can change if anyone does too much of pranayam. So that needs to be taken care for. And the common mistake can happen in one more thing I would say, the Kapalbhati, which is really a very great pranayam because it stimulates the thyroid, and that has an impact on all the hormones which can be released and many other systems. So it's very important to know that what are the benefits of pranayam. So can I have the slide, if that's okay?
Yes, ma'am, please.
Okay. So I would put that, so then they will be able to, visualize this. So it will be, understood slightly better. Is it visible slide?
Yes, ma'am, please, we are able to see it.
Yeah. So who should do pranayam? Everybody and anybody can do. Which positions? As I said, ideally would be good in sitting. If we are sitting, we should be sitting little bit straight, because if we are too much straight or too bent, that's going to put a strain on our lungs. We will see today what are the advantages and 2-3 techniques, and most important, the precautions. So when we used to say pranayam, this thing used to come to our mind, that being in Himalayas and all those yoga people practicing, that was their ancient. But now we are applying this in our day-to-day life, and we are applying this whenever, even in diseases. So with many problems also, we are applying this pranayam techniques for the benefit of our general health and so on and so forth. So what happens generally with pranayam? There are many, many benefits. So it's opening of small airways inside our lung. So when we do Dirghashvasan or Anulom Vilom, these two things, complete opening of small airways. So the oxygenation to the tissues is good and the ventilation is good. If there is an excessive like hyperventilation, the respiratory rate normalization happens. So if we find ourselves that I am stressed, we'll see that the respiratory rate changes. We are in a stress. Our cheek muscles also become, very strained. We should just check care and do 2 or 3 Anulom Vilom cycles. You will feel good. Apart from it, when we do the Dirghashvasan pranayam, there is a big change in the lymphatic drainage. So if people have edema in their legs, in their lower part of the body, it's extremely good to do the deep breathing techniques where the lymphatic drainage is stimulated. So even the swelling, which the lymphatic swelling can get reduced. So many times, even after having chemotherapy and things, or the surgeries for cancer, there can be this swelling in the lymphatic system. So lymphedema, one of it, the management comes with doing the deep breathing techniques. The second thing, by doing the other Anulom Vilom and Kapalbhati and Ujjayi Pranayam, there is an autonomic function. So autonomic nervous system function can get regularized. So it is this system which is not under our voluntary control, we can regulate by doing pranayam. So also after doing the technique, we must understand that we can feel very relaxed when the oxygenation reaches. Apart from it, when we do the special techniques, there is a strengthening of several muscles which are very important in our body, the respiratory muscles like the diaphragm and the intercostals. So they can become stronger. Along with it, the abdominal core, which is called as the transversus. Deep below, we find many people having laxity in the abdominal muscles. We had done a study on doing this pranayam of Kapalbhati, that we found that the core muscle strength inside gets reduced and even the abdominal girth can get reduced. Of course, it needs a long practice. We don't get results instantly and immediately. Muscle strengthening effect, it takes about 2 months or 6 weeks to 12 weeks to happen. So nothing can have very quick, there is no quick fix, though we do feel immediate impact of doing pranayam technique. For getting the strengthening, it needs time. Also, with the pelvic floor muscle activation, if we do correct pranayam, that's going to get stimulated and that's also can get strengthened. We don't need any external apparatus for breathing. So that's again the benefit of using pranayam techniques. I would just highlight 2 or 3 pranayams, which I have already said about the Dirghashvasa, Anulom Vilom. I hope these few techniques everyone knows. Anulom Vilom is breathing through alternate nostril. Like initially to take breath through both the nostrils, then close one and breathe in from the left side and then breathe out from the right. So we have to close alternate nostril, take a deep breath from here, breathe out. From the left side again, take a breathe in, breathe out from the right. This gives the normalization of the autonomic nervous system and it opens up the ventilation, the deeper alveoli in our lungs. The next comes the Ujjayi Pranayam. Anybody who has hypertension problem or pregnant women or those who had just a surgery, they should do only 3 to 5. So not to overdo, that's the first thing if we are having such any acute illness or a problem. They should continue with slow and Anulom Vilom Pranayam. While doing Ujjayi, it's like closing the glottis slightly when we are doing, and it's like making the child cry sound. This stimulates the thyroid glands very well, and it also increases our lung capacity. So Ujjayi Pranayam about 5 times, then take a deep breath while you're doing again the Ujjayi. I feel rather than talking about the technique, should we explain this technique about Ujjayi Pranayam?
Yes, it would be nice, madam, if you can explain Ujjayi Pranayam.
Okay, great. So whenever we do any such forceful thing, always I would recommend that sit in a straight position, or you can be sitting in Sukhasana or a cross-leg sitting. But you can also sit in a chair and be very comfortable at it, but not to slouch down. Like you should be straight. Though you can sit on a chair or you can sit cross-legged, you should not be bending from your spine. So be alert. And then you have to take a deep breath in through the nose and then close your mouth and make the sound and as if closing the glottis, how the child cries while breathing out. Take a deep breath. You should not feel that any strain coming anywhere. If you feel strain anywhere in your throat, muscles, then something is wrong, or you should wait and not to do it for too long. So if you do it about 5 seconds, slowly increase that time till you feel comfortable. As you practice in about a week's time, this breathe out time will increase. It has a great effect on thyroid. It has a great effect on our voice quality. So that's an added advantage of doing this pranayam technique, that there have been studies and they reported that they feel that they can reach higher notes in singing and they can take more notes in one breath. It's important to have the respiratory capacity in singers. So it's an added advantage along with the autonomic nervous system, along with having the thyroid problem correction about the voice quality. So that's really great. But as I said, that pregnancy or recovering from acute illness, or anybody is really having hypertension or hypotension, first that should be slightly controlled before we do more techniques, other from Dirghashvasana and Anulom Vilom. The next comes Kapalbhati, which is great pranayam technique for improving the muscle strength of breathing as well as the abdominal muscles. Only one important thing, what happens in Kapalbhati, different ways Kapalbhati is taught. Some say that you close your mouth and breathe out, taking from the abdominal muscles, strongly taking in. It is like doing this quick. Some say you don't even think about abdominals, but you just breathe very quickly from your nose. But very few yoga trainers talk about the pelvic floor muscles. And I would recommend that you can see on the picture out here that this is our abdominal pelvic region. This is where the breath breathing, the diaphragm is. This is the abdominal muscles here at the back, the spine. These are the pelvic floor muscles down under. So if anybody has, had more pregnancies and now taking up pranayam, or anyone has got abdominal surgeries or surgery in this region, care has to be taken that when breathing out is done from abdominal muscles activation, first start from pelvic floor. Pelvic floor muscles are there to control our urine and stool, so back and front passage. So try to pull gently up towards before starting this technique of Kapalbhati. So begin with pelvic floor, then activate the abdominal muscles to force breath out. So first begin with pelvic floor, transversus, breathe out. So anybody who is doing Kapalbhati should first activate this pelvic floor and then the abdominal together, so that there is no downward displacement coming on this. Especially when people are not trained, and as you said, looking only at TV, they may not know what is happening. So if they're forcefully breathing out, there can be downward more displacement on the pelvic floor area. So for Kapalbhati pranayam, just close down from under, then the abdominal muscles to breathe out. Start with doing 5, then again do 5. Don't overdo. That's the best thing to happen. People can do even 60 and more. Once you get trained, you can do much more. Okay. So I feel you should be able to understand the difference, and the Kapalbhati pranayam is quite significantly challenging. It's more strengthening to the pelvic floor as well as abdominal as well as respiratory muscles. So any other thing you would like to ask?
I think we just did not know this important information, that when we are practicing Kapalbhati, we have to not only focus on the abdominal muscles, but also the pelvic floor muscles. This is a vital piece of information that is not shared. And today, madam, you have shared this with us. We are very grateful. So many of us did not know about Ujjayi pranayam, and so many of us did not know the right way of practicing Kapalbhati. So we are very grateful to you for doing this with us, for sharing your knowledge with us. Before going, is there any other information that you want to share with our viewers as to how should we practice pranayam? Can pranayam be practiced at night?
Oh, yeah, very good question. Pranayam can be practiced.
1 second. Can you stop your screen sharing?
Yeah. I will just stop.
So I'll repeat this section again because it's not got recorded well. All right. So thank you so much. You shared vital piece of information. I'm very sure very few people knew about the importance of pelvic floor muscles along with abdominal muscles for pranayam. This is a vital piece of information, a new piece of information. Thank you so much for sharing this information, and so many people who are watching this would benefit. One major question that a lot of people ask me is, I do not get time to practice pranayam throughout the day. I'm busy. Can I practice pranayam at night? So what is the answer to that question?
Yes, if you're busy throughout the day, there's no problem in doing at night. Kapalbhati and Ujjayi, don't do too many at night. You can do Anulom Vilom at night because you want the respiratory system to calm down. Because with Kapalbhati, we are doing hyperventilation. We are doing too many times than what we normally do. But if you are not getting any time during the day, you do it 15 minutes before you go to the bed. Just before going to the bed, you are hyperventilating. So you are making yourself, the system more alert. We want to make it cool down and your brain needs to sleep. So 15 minutes before, if you do all the 2 or 3, 4 techniques, that's fine. But if you don't have more 15 minutes and you're feeling sleepy, but you want to not to miss session of pranayam for the day, just do 5 times Dirghashvasan and Anulom Vilom. And if you have half an hour before you're going to sleep, then you can do Kapalbhati, you can do other pranayam techniques, anyone which you like. There are many more, 4, 5, 6. That needs.
How much time gap is required between dinner or meal and pranayam? What kind of time gap should we maintain?
At least 1 hour, because the abdomen is not going to allow the diaphragm to move so much. So if you are a very light eater in the evening, no problem. Some people have a habit that 2 full meal in the night. Can't. Then 2 hours will be required. So it depends how full you are. So normally 1 to 2 hours should be taken after the meals. But if you're too hungry, that's also not very good time, because too hunger, you can't focus and concentrate on yourself. So if you're too hungry, just have something, wait for 10 minutes, and then you can practice.
This is important. So after a meal, 1 hour gap before practicing pranayam. And if we are going to have a lot of time at hand before sleeping, if you're going to have half an hour before sleeping, then we can practice many pranayams. But if we have very limited time with us and we just want to go to sleep, then only Dirghashvasan and Anulom Vilom are pranayams that will help our respiratory system calm down and help us fall asleep. Is that correct?
Yes.
Thank you so much, madam. You have shared vital information. I am sure everyone is feeling so happy watching you right now. Everyone is now going to feel more encouraged to practice pranayam every day. Thank you so much for giving us your precious time. We would want to connect with you again on another day, discussing another important topic of pranayam, of yoga, and how it can be used for diabetics. Thank you very much.
Thank you.
To the viewers, remember to like, share, subscribe to the channel. Thank you very much for your valuable time.